Okay, so today I wanted to run through some different supplements and one essential oil that can be beneficial if you are dealing with symptoms of anxiety or depression. Now, you're going to find that some of these you've heard before, particularly in relationship to sleep or cortisol levels. But the first things that I have used in my office, treating my patients, and I had good success with ashwagandha, magnesium glycinate, magnesium threonate, L-theanine, and inositol. These are all things that I have used with patients in my office to help with anxiety and depression symptoms. Now, the next thing is EPAs. When we're talking about EPAs, we're talking about fish oils. Typically, fish oils have EPAs and DHAs in them. Sometimes they'll also have GLAs. The significant research, though, has been done on the EPAs and its beneficial use in relationship, particularly to depression, but also anxiety and other mental issues. 1 to 3 grams of EPA a day has been shown to be beneficial in particular. Now, I do have some other things that I'm going to list off for you. These are things that I found research on that showed that they could be beneficial for anxiety and depression symptoms. However, I don't know that I've used them personally for anxiety or depression symptoms in my patients. Now, some of these are things that I use. For example, curcumin, lavender oil, melatonin. I use these things in my office with patients when appropriate, but it's not something that I've used to treat anxiety or to help patients with anxiety or depression symptoms that I knew of. But there is good research to show that melatonin can be beneficial, particularly for postmenopausal females. Can see improvement in anxiety and depression symptoms with melatonin. Saffron, Saffron. Again, this is not something that I have used in my own practice, but there is some good research to show that it can be beneficial for these anxiety and depression symptoms. So I wanted to give you that. Lavender oil, kava, and curcumin. All of these things have good research showing that they can be beneficial in certain situations for certain patients. Now, as far as dosages are going to be largely related to your age, sex, body size. So if you have questions, please put them in the comments and I will get back to you ASAP. I hope that you've enjoyed this video. I hope you find it beneficial and look for my next video. Thanks. Bye.